Welcome to our video on emergency contraception and sterilization. Let's get started. Here is our overview slide. Let's begin by discussing emergency contraception. Specifically, with regards to this topic, we'll be reviewing the indications, contraindications, and the options available for emergency contraception. The purpose of emergency contraception is prevention of pregnancy following either unprotected sex, failure of a contraceptive method, such as a condom tear, or contraceptive negligence, such as a missed pill or an appointment for a depot shot. The key about emergency contraception is that its purpose is prevention of pregnancy, not termination or disruption of pregnancy. This is why the primary contraindication to emergency contraception is a known or suspected pregnancy. Again, if a woman is already pregnant, it's too late to use any of the emergency contraceptive options. The options for emergency contraception include emergency contraceptive pills, also known as the morning after pill, an emergency copper IUD, and selective progesterone receptor modulators. Let's discuss each of these in a bit more detail. Emergency contraceptive pills, or ECPs, are essentially pills containing high doses of either estrogen and progesterone or progesterone alone. They function by inhibiting tubal transport and implantation of a fertilized egg. These pills must be taken within 72 to 120 hours of unprotected intercourse for full effect, although the sooner they're taken, the better. There are no special contraindications to using ECPs, even if they contain estrogen. That being said, women should not rely on repeated use of ECPs as a main form of contraception, as there are other more effective methods available for this purpose. Lastly, ECPs will not harm an existing pregnancy, and hence they do not require a pregnancy test before administration. Okay, now let's discuss an emergency copper IUD. These work by eliciting a sterile inflammatory response within the uterus, thereby minimizing the likelihood of fertilization. A critical point to know about an emergency copper IUD is that it's the most effective form of emergency contraception available. In other words, if ever asked about emergency contraception on exams and copper IUD is an option, it's most likely to be the correct answer. A copper IUD must be inserted within 120 hours of unprotected intercourse for maximum efficacy. And just like with ECPs, it will not harm an existing pregnancy. Unfortunately, though this is the best option for emergency contraception, it cannot be used in women with contraindications to IUD placement or contraindications to copper IUD placement specifically. All right, let's review with a simple question. What are the contraindications to placement of copper IUDs? Because a copper IUD is the most effective form of emergency contraception, it's a very attractive answer choice on exams. Examiners know this, which is why it's important to reiterate the contraindication specific to copper IUDs in order to recognize clinical scenarios in which copper IUDs are not the best choice of emergency contraception. Those contraindications are Wilson disease, copper allergy, menorrhagia, and dysmenorrhea. Wilson disease is a genetic disorder characterized by excessive copper retention in the body, which means that a copper-based IUD could make symptoms a lot worse. A copper allergy and a copper-based IUD are clearly not a good mix either. Menorrhagia and dysmenorrhea would get substantially worse after placement of a copper-based IUD, so these aren't good options either. Selective progesterone receptor modulators work by delaying ovulation and inhibiting implantation of a fertilized egg. Ulipristal is the most commonly used agent. Just like with copper IUDs, these must be taken within 120 hours of unprotected intercourse for maximum efficacy. Importantly, selective progesterone receptor modulators cannot be used in breastfeeding women due to their anti-progesterone effects. Additionally, unlike ECPs and emergency Paragard, selective progesterone receptor modulators will harm an existing pregnancy, which is why they require a pregnancy test before administration. Here's a table summarizing the most salient aspects of each of the forms of emergency contraception that we've discussed in this lecture so far. Feel free to take a minute, pause the video, and review this information. All right, let's review with another question. What is the most effective form of emergency contraception? The most effective form of emergency contraception is the Paragard copper IUD. All right, now that we've discussed emergency contraception, let's move on to sterilization. With regards to this topic, we'll be discussing vasectomy and tubal ligation. So starting with vasectomy, this is a surgical procedure characterized by ligation of the vas deferens under local anesthesia. Here is a figure depicting the basic male anatomy. Normally, sperm travels from the epididymis through the vas deferens and eventually into the urethra during the process of ejaculation. As I just mentioned, vasectomy is characterized by ligation of the vas deferens, which prevents sperm from being able to reach the urethra. While no sperm can make it from the epididymis to the vas deferens after the procedure, viable sperm remains distal to the ligation site, which is why it takes time to achieve infertility following this procedure. In fact, patients remain fertile for about 6 to 8 weeks following a vasectomy due to the sperm that remain distal to the ligation site. As a result, patients should use another form of contraception, such as condoms, during this period of time. As an extra precaution, clinicians may offer patients a semen analysis at the end of those 6 to 8 weeks to confirm azoospermia and infertility. Lastly, it's important to inform patients that this procedure is generally considered to be permanent. Reversal is possible, however, it's quite unreliable. Okay, now let's discuss tubal ligation. As the name suggests, this is a surgical procedure characterized by ligation of the fallopian tubes. This procedure can be performed immediately postpartum or scheduled at a different time. Importantly, clinicians must counsel women about the risk of regret, especially if a woman is younger than 30 years of age. For all intents and purposes, this procedure is considered permanent, and though reversal is possible, it's unreliable. Here's an illustration of a female uterus. By means of orientation, here are the ovaries, the fallopian tubes, the uterus, cervix, and vaginal canal. In the process of tubal ligation, the surgeon would ligate each of the fallopian tubes, thereby preventing the ovum released from the ovaries from ever reaching sperm cells. Again, for all intents and purposes, this procedure is considered permanent. All right, let's review with the final question. A 35-year-old man comes to the physician to discuss different forms of contraception. He has 5 sons, and he no longer wishes to father a child. The physician outlines different types of reversible and irreversible contraception, and the patient decides to undergo vasectomy. He understands that the results of this procedure are permanent. After the procedure, which of the following is the best recommendation for this patient? A. Use condoms for at least 6 to 8 weeks after the procedure. B. Resume unprotected sex immediately after the procedure. C. Regular screening for chlamydia for the next 6 to 8 weeks. Or D. Regular screening for syphilis for the next 6 to 8 weeks. All right, so this patient decides to undergo a vasectomy. This is a permanent form of male contraception achieved by ligation of the vas deferens. Viable sperm still remain in the segment of the vas deferens distal to the point of the ligation 6 to 8 weeks after the procedure. This means that unprotected sexual intercourse during this time period can still result in pregnancy. Therefore, the patient should be advised to use condoms for at least 6 to 8 weeks after the procedure. So the correct answer is option A. Recall from this slide that patients remain fertile for 6 to 8 weeks following vasectomy. Therefore, patients should use another form of contraception during this time period, such as condoms. Let's discuss why the other options are incorrect. Option B is incorrect because if the patient resumes unprotected sex immediately after the procedure, this may result in an unintended pregnancy. Options C and D are incorrect because, as a general rule, patients do not have to undergo regular screening for chlamydia or syphilis after vasectomy, unless there are specific indications for screening, and this patient doesn't have any risk factors for either of these conditions. So again, the correct answer is option A, and that concludes this section.